Hello, folks. Another episode of Burning Platform. Real honor to have Geeta Nayyar, who goes as Dr. G, who is SVP and Chief Medical Officer at Salesforce. Dr. G, thank you so much for joining me. Let's start off. Why don't you tell the audience a little bit about your background? Obviously, you started off in medicine, practicing medicine, and you've been a CMO at a couple of other organizations. So describe your journey.
Sure. Well, Vinnie, first, thanks so much for having me. Always good to talk to you. I appreciate the time. You know, my path, I think like so many of us, was really a path of happenstance. I am a passionate physician first and foremost. I am still a rheumatologist practicing at the University of Miami. And I always say I'm a physician first and a health tech executive second, which I do believe is still the correct way to go about transforming healthcare. You know, I come from a family of physicians. My mother is a doctor. My dad is a doctor, both still practicing and doing really well. And look, I was very much went into medicine to be a doctor, but learned very quickly on the front lines that so much of what drives frontline care happens on the administrative side, whether it's the lawyers, whether it's the policymakers, whether it's the insurance companies. And so I really went into business and tech with the mindset of, how do we transform the front lines to deliver better, more efficient, and high quality healthcare? And I still maintain that view today, and have been really privileged to have the journey that I have. But we got a lot of work left to do, certainly.
Well, since you've been in the policy making area for the last few years, let's start at the really macro level. So, you know, the US spends almost a fifth of our GDP on healthcare, right? And yet, if you look at the outcomes, health outcomes, we're not even in the top 10 in many categories in the developed world, right? So if you were, you know, if the president were to call you up and say, you're the national CMO, what are the top 3 or 4 things you would say, I'm going to prioritize this for the next 3 or 4 years? What needs fixing, absolute fixing? How would you prioritize that?
Well, first of all, I would welcome that call. So if you know someone who knows someone, ask someone to give me a call, because I welcome the call.
Maybe they'll watch this video and you will get that call pretty soon.
And I have way bigger of a list than 3 or 4 things, but I'll start with a few. So number one, the cost of healthcare in the United States is astronomical when you look at the quality that we deliver, right? Multiple factors for that, but I would actually first start with the training aspect, which is the amount of debt it takes to become a doctor, a specialist, a surgeon. So many of our young physicians that I work with are forced into specialties when they would have actually preferred primary care, but because they've got $500,000 in debt and they're 25 or 30 years old, they've got to find specialties that are high paying. And so that goes to my second point, which is we do not prioritize primary care and prevention. We really do still very much practice reactive and procedure-based medicine. Lots have talked about value-based care, but we're really not there yet. And our culture and our incentives are still in these high-cost areas, and that really drives care, and that drives the patient experience, and that drives outcomes. It all goes back to training, infrastructure, but reimbursement drives behavior, and our culture, unfortunately, also is that, you know, patients walk in and they want a pill for everything. There's not this emphasis on prevention and primary care, and that's really where the ultimate shift has to happen. Of course, investments in infrastructure, we saw so much of that happen during COVID. The inefficiencies that exist, you know that our workforce is very much burnt out. We need to invest in infrastructure that works, that scales, whether that's technology, whether that's training programs, whether that's any number of investments that are lacking in that space. Interoperability, another big piece of that, or part of that, is when we do, you know, 6 X-rays at 6 different hospitals for the same one patient. So that ability to share data, and security, safety, privacy, all of this has to be done with security, you know, HIPAA, all of these things in mind. Cybersecurity needs to be an emphasis as you build that tech infrastructure. So just a few things, but certainly not small ones. And then last but not least, the issues we have around health equity. And as we think about telemedicine being one part of the solution, not the silver bullet that we all wish it was, but really addressing those most vulnerable populations is key to driving down a good amount of the cost. And to your point, the quality, right? When we look at maternal fetal health, one of the biggest indicators of how a global population is doing, we do not do well. We do not score well. And so there are any number of basic things that we here domestically need to focus on, from prevention, maternal fetal health, basic workforce issues that all bleed into the system and continue to attribute. I got about 25 more, but I'm gonna go easy.
So Dr. G, that long list you have, if you did get that phone call, I would ask for 2-term commitment, not just one. You'll need that much, unless, like McKinsey says, the rate of innovation really accelerated during the pandemic. They had a recent report that said they saw boards and executives turn on a dime, right? New products in a couple of weeks, new services in a couple of weeks. And they were bold enough to make the prediction that if it continues at that pace, the next decade is going to be the most innovative mankind has ever seen. And I step back and I say, is that possible in healthcare? Healthcare just seems so ossified, right? Is that rate of innovation possible in healthcare? What would you say?
Look, I'm a forever optimist, and I would say that COVID definitely accelerated the digital transformation, digital innovation. But a big part of that was that regulations were opened up, whether they were on telemedicine, whether they were on medical licensing. So regulation tends to pull back that innovation. And so I do think for a highly regulated industry, we have to look at those regulations, make sure they still make sense, make sure they are fostering the innovation and infrastructure that is so desperately needed in healthcare, telemedicine being one of them. We've proven that we can do it, whereas in the past we said physicians wouldn't do it, consumers wouldn't do it. What would we do about medical licensure? And it's such a great example of how we were able to extend the patient-physician relationship at scale, whether in suburban areas, whether in rural areas, and just being able to have a visit in the home and actually talk to a patient and say, show me what you're eating, show me what's in your fridge. I mean, these were really neat visits in the home that happened and transpired and leapfrogged years, what would have taken years, and what we have been talking about in healthcare for a long time. We did do it just like that. We have a lot to learn from other industries, hospitality, retail. When you think about the consumer experience, no one really ever glows about their experience in the hospital or the doctor's office, even when they love their doctor. It's usually in spite of that, in spite of the fact that they love their doctor, they manage to get through. So I think there's a lot of space, but the regulation needs to really help us get to the innovations much quicker.
You're right. In life sciences, we saw clinical trials for the vaccines dramatically reduce the whole cold chain of logistics of distribution. I mean, so yes, a lot of speed, but it just seems like maybe that was a one-time thing. I don't know. I don't see the same level of continuity. Let's talk about electronic health records. I saw you present and you did a great job. You stood up, you turned your back to the audience, and you pretended to be typing. And you said, that used to be my patient interface. Basically, electronic medical records have been a pain for practitioners, not available to patients, and all the data that we've collected, we haven't applied machine learning or anything really to it, right? It's a frustrating area. How do we change that? Because that seems like a big opportunity from a technology perspective, but it just seems daunting.
Well, first of all, I wish I was pretending. That actually, has been the experience for way too long with the EHRs. But I think that's the opportunity. So, we started with EHRs, which we very much did to physicians and to nurses. We did this to the care team. We're in a place now where for the first time, the care team is getting the attention and focus they need, and the realization that to have good patient engagement, you need to have good physician engagement, good care team engagement. And so now as we look at technologies like the ones at Salesforce, we are looking at the problem of the tech infrastructure and saying, how do we complement these legacy systems, right? The reality of ripping or replacing those is very unlikely. So how do you instead augment those systems to work better and to work in a consumer-centric model that healthcare has pushed to? And so it is really finding those right pain points and also figuring out the things that can be taken off the care team on the front line and being taken care of on the back end, or to your point, automated. whether it's AI, whether it's machine learning, whatever the different technologies out there, how can you automate the different pieces of data, whether intake, whether analysis, whether diagnostics, how can you take those things off, those three things off of a care team's list so they can actually focus on the patient?
So let's turn to another part of the healthcare ecosystem that was kind of inconsistent. Public health, right? It almost like that they could have, it was their opportunity to shine in a pandemic, and yet the advice was so inconsistent, so slow in some cases, that they actually didn't really people almost lost trust in the public health system, or at least the information flow from the public health system. Is it because of lack of money investment in that? Is it a bureaucratic? What would you say? What failed in the public health system?
So I would say yes to all of that. A big part of what failed, it was multiple things, but a big part of what failed was so many data blind spots. Our public health officials didn't have the data they needed at the time that they needed it, right? A lot of it was retrospective. Obviously, a lot of the science was coming in in a very dynamic way, but we had so many blind spots as to when there was a breakout, where it was, what was hospital capacity, what was the data that we were even able to share domestically, let alone internationally. So data is certainly being one of those things in real time being more important than ever, especially in a public health crisis. But we are also living in an era of misinformation. And while while that's not new, you know this in the South Asian community, right? Everything can be cured with ginger and garlic. Hashtag, right, truth. It's important to recognize we're living in a really historic time and cultural place where technology is being manipulated by the masses to really drive the masses for different reasons, different stakeholders having different incentives, politicizing health information in a way that we've really never seen before. But the concept of misinformation is not new, but what has happened is it's kind of been weaponized in this way that it really never had been before. And I think that's really the opportunity from a public health perspective, is how do you actually improve the communication of healthcare, which is really complicated topics and subjects. And when you think about enabling physicians, when you think about celebrities, when you think of all the different stakeholders that from a public health communication standpoint could be leveraged in a way that was more scalable, more unified, or even using social media or technologies like ours, a CRM, to be able to put a patient on a patient journey from a marketing or education perspective, that's not something that the average physician has available to them, or the average nurse. And yet all the patient wants to know is what you think, right? All my patients want to know, Dr. G, what is your advice? Because I can get advice from everyone else anytime, but why can't I get it from you, right? Why don't you have a social media presence or following, or this clinic or this hospital? And why are you not the person that's arbitrating this information? So I think there's many different opportunities here, but perhaps like every relationship, trust and communication are key. We have to find a way to really scale that and really battle this era of misinformation that we're in.
So, on the misinformation part, I mean, I kept asking a year and a half ago. I've written case studies with the National Hurricane Center in Miami, spent time with them and so on. When the hurricane is approaching, they use a lot of data, a lot of
That's right.
quantum computing, et cetera, to be able to provide the track and so on. And then it gets disseminated by local weather people, local communities make their own evacuation guidelines and so on. It just seems like during the pandemic, the media would only report number of cases when they should have been reporting, hey, look, this is the number of beds available and all that. They just fixated on the number of cases, right? So it just seems like maybe because it was the first time, the information that was put out by the public health agencies wasn't consistent, but then it wasn't used consistently either. So I don't know. I think there's a lot to fix in public health.
100%. And look, there was also poor data collection. I mean, there was no way to collect data at scale or in an automated way. So there were many, many breakdowns. But again, we look back now and we certainly hope that those investments will be made, and that we next time will not be caught off guard. And do let me know when you're in Miami next. That's my hometown, and you're right. They're better prepared for a hurricane than a public health crisis. I don't debate that at all.
Well, let's talk about globalization, obviously benchmarking and so on. Healthcare seems like it's one industry that is very regional, right? I mean, we can't really, our practices, our certifications are very different than in the UK. Our provider payer systems are very different. It's not like the UK can compare itself to Germany. I mean, it just seems like very national, almost regional, right? Do you see that changing ever? Because I'd love to learn from how Singapore does things, not necessarily the UK, but there are some markets that I think the US can learn from. But it just seems like we just say, hey, we are so different, we can't learn from anybody else. Do you see that changing?
So again, I am forever an optimist. I always believe in the silver lining and the better picture. Do I think it will change anytime soon? Probably not. But I do think the world has gotten a jolt from the pandemic, and many people have taken away the lesson that healthcare is a priority and basic things need to be done. But fundamentally, the culture domestically is different than in Europe, is different than in South Asia. So some of these are regional because the culture, right? Culture is not something that changes overnight, and it does take a combination of the people as well as the government policymakers. So again, forever optimistic that we will make improvements. Not really sure that there is one ideal system that exists across the board, but certainly things we could all learn from each other along the way.
So Dr. G, maybe a personal observation, but every time I go to Costco, I'm fascinated how big the supplement section is, right? And all kinds of roots and herbal supplements and so on. And it seems like a lot of individuals are willing to experiment a lot more. You mentioned we're much more about fixing symptoms versus lifelong health and so on. It seems like individuals are much more into yoga and acupuncture and chiropractic and so on. You think that is a broader trend that's going to happen, or is it still going to be individual specific?
I think the consumerization of healthcare domestically is here to stay. People are interested in their health. They want to have control of it, right? That's why they're walking around with these devices. They may not always know what it means, what happens to their heart rate, right? But they are interested in that do-it-yourself tools. They're interested in the do-it-yourself organization that's talking to them, whether it's about vitamins and meditation, or just tips on mental health. I think that there is this new priority of health and the consumerization and this idea of I can take control, want to take control. And if I am going to see a physician or a nurse or someone on the care team, I want to work with someone who's actually going to partner with me. I think that shift has fundamentally happened and will continue to, because we've also seen it in other industries. So the consumer out there is seeing that with everything else in their world, and they're saying, why not health? Right? Why should health be the exception?
So you've got a long list of things you would fix. We've talked about some of the issues we saw during COVID. What keeps you optimistic? Tell me 2 or 3 things that are working well that we should build on. Let's end on a positive note.
Sure. Well, look, first of all, COVID was very, very difficult for all of us. And again, it's still not over, but we have really come together, I think, as a culture, as a society, globally. We really did all experience it at the same time. And we walked away with a renewed sense of healthcare is a priority. It is not, it's not a nice to have, it's a must have, whether it's for personal health, whether from business organizations saying our employee health is now a tool for retention and productivity, and it matters. And you see any number of companies like a Salesforce hiring chief medical officers saying, figure this out, lead this initiative for the C-suite. So I think we've certainly made progress in that regard. We see tons of innovation happening in healthcare. It did not slow down. It accelerated to the points we talked about earlier. I think that will continue because there's a market there, and it is so tremendously expensive. So anyone who can cut those costs, drive that quality, has space to grow, has space to be successful. And last but not least, the consumer is demanding it. The consumer is demanding it. We're also seeing retailers enter the space. We're seeing newcomers to the market disrupting healthcare in a way that they have not been looked at before. I mean, to this day, you can't get a COVID vaccine anywhere but at a major retailer. You can't come into my office and get a vaccine, right? So they now have this market share and they have the consumer, and they're saying, you know, we can also do your flu shot, and we can also check your blood pressure, and you could also grab some milk and eggs on your way out. That's a very interesting value proposition that a doctor's office doesn't offer. So when you look at some of the big players like a Walmart, a CVS, there's ample opportunity for them to change this landscape. And I think that they are, and they continue to will. And I think it's good if we continue to improve access and provide care in communities that haven't had them.
Well, and then, you know, it's good to see Jujar saying, you know, the vertical team at Salesforce, they presented to me a couple of times on health and life sciences. So you guys are obviously seeing the opportunity to deliver some of the innovations you're talking about. So let's end it at a positive note. Thank you, Dr. G. This is fantastic. And I will call a few people in DC, so you may get a phone call.
Wonderful, wonderful. Vinnie, great to talk to you. Let me know when you're in Miami next.
Will do. Thank you so much.
Take care. Be well.